The Institute for the Study of Peak States presents the first International Psycho-Immunology and Psychobiology Research Symposium. Using psycho-immunology to treat obsessive compulsive disorder, presented by Jennifer Beattie.
So our next presenter is Jennifer Beattie. So Jennifer has a master's degree in marriage and family therapy and is a registered psychologist in Alberta, Canada. She was trained in the Institute in 2012 and her research focus is on obsessive compulsive disorder. So Jennifer, over to you.
So, like Shane had said, my name is Jennifer Beattie and okay, great. Thank you, Shane. And I've been with the Institute for quite a few years now, about 8 years. And Grant had asked me to participate in research on OCD, which is obsessive compulsive disorder. And I have a particular interest in this. I've been working with clients with OCD for a number of years, probably 15 years off and on in my practice, and I have personal experience with it. So I jumped at the chance to participate in the research. So what is OCD? First of all, if for any of you who aren't familiar with it, it is categorized as an anxiety disorder. The DSM, which is the Diagnostic and Statistical Manual, defines it as recurrent and persistent thoughts, urges, or images that are experienced as intrusive, unwanted, and that in most individuals cause marked anxiety. And these thoughts, images, or impulses are not simply excessive worries about real-life problems. So basically, OCD is an anxiety disorder, and throughout history, it's kind of it changes in terms of criteria based on what people are thinking, what belongs to the OCD, or what maybe is a different anxiety disorder, such as generalized anxiety disorder. But if you boil down what people with OCD present as, it often is an intense fear and also has contamination kind of elements to it as well. So the classic example would be someone who has a lot of worries about contamination, about getting germs. And so they would have a lot of worry thoughts about, if I touch the door handle, there's somebody might have touched it that has terrible illness before me, then I touch it and I'm gonna get sick myself. And these worry thoughts would just replay and replay. And of course, the compulsive component of that one would be washing hands, for example. So you'd wash your hands. So there's an obsession component and a compulsive component. So if you ask people what is the biggest thing that really is upsetting with the OCD, they'll often say it's the intense fear feeling I feel whenever, and it can get triggered by so many things, and for different people it gets triggered by different things. So for example, some people will be the fear of illness, other people will have fears about their house burning down, other people will fear that something bad is going to happen to someone they love. I mean, the obsessional quality can be different among different people, but the commonality is that intense fear feeling. And like I said, often there are like these contamination kind of qualities as well. So the current psychological treatment for it is cognitive behavioral therapy, which is what I've used with clients throughout the years. And there is some some success with that in terms of symptom management and some symptom reduction, as well as, of course, antidepressant medication, other medication, but that is used basically just to manage symptoms or reduce symptoms so that people can be more functional in life. So getting on now to the psychobiology or psycho-immunology approach to OCD. The question posed by this research was, what mechanisms in a person's biology might contribute to or cause the OCD symptoms? So like Kirsten was saying, what might be the root causes? Instead of just symptom management, what could be the root causes of OCD symptoms? So in doing this, like Grant had said before, it involved regression. So we would regress to very early developmental events in an attempt to figure out where the symptoms might have originated. And the symptoms that we were focused on were the fear feeling and the contamination elements that were often involved in OCD people. So at this point in research, and this is unfolding research too at the moment, we found two early events that contribute to the vulnerability to have OCD symptoms. One event contributes to the anxiety elements of it, and the other event contributes to the contamination elements of the disorder. So in speaking generally, we found that in these early developmental events, the very early emerging self of the person, so think way, way, way back in development, this very early self experienced a physical injury or a trauma. This physical injury or trauma turned out to create a vulnerability to what we found to be a parasite attack. So the internal mechanisms we found so far that contribute to OCD is twofold. The first mechanism is the physical damage or the trauma that occurred to the self. And Grant was saying earlier that when a person is screwed up or has this physical damage, it makes you vulnerable. And so the vulnerability was to these specific funguses. And so just getting into the research findings about a little bit more about these specific funguses that we've found thus far. So in the first event, the early developmental event, the fungus that, when this event gets screwed up or messed up, has trauma, the fungus that is opportunistic and attacks there, we call the fear fungus. And we call it this because this fungus creates this intense fear feeling for people who are infected by it. And we're currently hypothesizing that the fungus may secrete a chemical, and it's this secreted chemical that creates this strong fear feeling in the person. So we believe that the person with OCD is infected with this fungus. And this fungus secretes this fluid, and this fluid feels like fear. And this is what we believe is driving the anxiety component or the fear feeling component of OCD, is this fungal infection. The second parasite strikes at another developmental event. Again, at a moment when the developing self is vulnerable to attack, again, a very significant developmental event in the past. And this fungus creates a feeling of contamination. So at the moment that the fungus is attacking the self, it has a feeling of like everything's contaminated, I'm ruined, something bad's happening, something bad's gonna happen. And this feeling like, I can't control this, I need to stop the contamination, I can't stop the contamination, kind of that kind of stuff. And so this second fungus, which we're calling the contamination fungus, is what we believe contributes to the compulsion, some of the compulsion aspects of OCD and the contamination aspects of OCD. So in terms of the OCD process, it's, like I said, fairly newly emerging. We've used a process that goes to an even earlier developmental event, one that actually enables the parasites to enter in the first place. So there's lots of layers to how the research has gone and the different developmental events that are involved in this. But we find by healing this even earlier event, the host, the person with OCD, is no longer vulnerable to these particular parasites and simply stops being infected. So this is the immunology kind of point or perspective. We're finding that when you do this healing with the person, it has the effect of, in the present, immediately the person will stop having these OCD symptoms or has a drastic reduction of symptoms. So you know immediately when you're doing the healing process if it's working or not for this person. And this process of, as much of research, has undergone several revisions and continues to be refined as new developments emerge. So I have some test results that I've done. I've done the process with 3 people, and the first 2 people were done to completion. And I wish I could have the page here on to share, but for some reason it's not working on my screen. So I will just read it out to you guys and hopefully it will make some sense. So I asked both clients after doing the process some questions that were relevant for people with OCD in terms of what percentages they felt symptom reduction or symptom elimination. And I'll just go through it because I find this to be very telling. So this questionnaire was done after doing 3 rounds of the healing process with these people. So the first question was, my previous obsession or worry thought, like the stuff I used to worry about, is reduced by. Client 1 said it was reduced by 80%. Client 2 said 75%. Question 2, my previous compulsion or the things I did to calm myself down to make the worry thought stop, Client 1 said is still existent, but about 90% less intrusive. Client 2 said minimal at present. 3, the fear feeling that I used to experience when I had a worry thought about something has decreased by. Client 1 said 100%. So the fear feeling stopped 100%. And client 2 said 75%. Question 4, obsessions and worry thoughts decreased by. Client 1 said 95%. Client 2 said 75%. Question 5, the looping nature of my anxiety thoughts decreased by. Client 1 said 95%. Client 2 said 80%. Worst case scenario thoughts decreased by. Client 1, 90%. Client 2, 60%. Question 7, compulsions or the things I felt urges to do to try to make the worry thought stop decreased by. Client 1, 80%. Client 2, 75%. My ability to have the choice to not do my previous compulsions increased by. Client 1, 85%. Client 2, 80%. Question 9, I can easily choose to not do my previous compulsions. Both said yes. Question 10, it feels like the driver or force behind the OCD is gone. Both clients said yes. The client, panic attacks have decreased by. For client 2, she had panic attacks. She said by 80% they had reduced by. Both clients said life has been made more enjoyable by the process, and both said they would recommend the process to other people. So as you can see or hear, pretty awesome results so far with the 2 clients that have done the process to completion, had pretty significant changes in their OCD symptoms. And for the 1 client, the fear feeling was completely eliminated. The 3rd client that I tried it on was only did 2 rounds. And even in those 2 rounds, went from an 8 out of 10, a feeling of anxiety, which had been pre-existing for years, to a 2 out of 10. And that held constant for the entire week between the 2 processes or rounds of healing. So so far in research, some pretty exciting results that we need to get more data on, of course. So what are the diagnostic challenges that for this particular OCD process? The big challenge is that anxiety can be caused by numerous things other than this fear fungus or the contamination fungus. Anxiety can be caused by biographical trauma, generational trauma, body associations, and all sorts of other things. So just because someone comes in and says, I have anxiety, doesn't necessarily mean this process will help. And we're needing to continue to get strong diagnostic criteria for figuring out which people with anxiety actually are likely to have the fear fungus and the contamination fungus, and which people obviously then would respond to the treatment. And for future research, we would love to continue to do research on people that self-identify as having OCD, and to determine which symptoms of OCD, and different people have different types of presentations, so which symptoms it might reduce, which symptoms it might eliminate. And then the next level of research would be trying the process with people who self-identify with various other forms of anxiety-related disorders, to try to figure out which of just general anxiety disorders might possibly be the symptoms could be reduced or eliminated by the process. So that's basically what I had today. Any questions?
Yes, thanks, Jennifer. So to the audience, we do realise that there was a clicking noise in the background. We were trying to identify the source and eliminate it, but we weren't successful, so we apologise for that. Got a question. If the OCD is caused by a fungal issue, so this is from Kathy Kelly, does the treatment include any type of medicinal therapy, or by healing the earlier trauma, does the fungus clear up on its own because the host is no longer open to it?
Go away in present time. So no medicinal treatment is necessary. It's not no longer, we're not no longer talking about symptom management. We're talking about symptom reduction or elimination, because the fungus is no longer present in the host.
Okay, great. When you're referring to the first event and second event, are the first event and second event specific developmental events, or can this be any of them?
They are specific developmental events, yes.
Yep. So that was from Dr. Wilfred Ehrman, actually.
Yeah, you bet. Yeah, we traced it back to these specific events where there was physical damage or trauma to the person, and where that then led to vulnerability in the person to these parasite attacks in these specific developmental events. Yeah.
Okay, great. Question from Holly Rankin. Hi, Jennifer. What led you in your research to suspect it is a fungus specifically infecting and causing these symptoms?
That would be more of a question for Grant.
I was wondering that.
He's the brains behind all of the operation, and it's his insight that led down that path.
Okay. Question from Dr. Douglas Schneider. How does having a fungus translate into an emotion or feeling?
So yeah, that's a part of the continued research questions. So far from the research, it appears that when a person is infected with the fear fungus, we're thinking it maybe is a chemical that is secreted by the fungus. It creates this it's a fear feeling, and if you ask the person who has the fear fungus what that fear or anxiety feels like, if they really put their awareness to it, they will describe it as surrounding them. It's almost like it's in the space around them. They're stuck in this fear feeling. Versus, for example, a biographical trauma, if you asked a person where do you feel the anxiety or the fear feeling, they'll identify it in a specific place in their body. The person with the fear fungus anxiety will say that they just feel like they're vibrating in fear, and it feels like fear, but we're thinking it possibly is a secretion from the fungus. But it's still more research is needed to continue to understand it better.
Great. Got a question from Claire Howell. If OCD is occurring in early developmental event, is the self being infected by a fungus present in the host, e.g. parent or grandparent, or going forward, could OCD occur less frequently as the fungi are healed from the population of potential parents?
Well, could you read that one more time? There's a lot there.
Yeah, so there's two questions.
Yeah.
So the first one is, if OCD is occurring in early developmental event,
Yeah.
is the self being infected by a fungus present in the host?
Mm-hmm. Yeah.
So if the child's being infected, is it also present in the parent or the grandparent?
We suspect so. I mean, again, I think more data is needed. The trauma that causes the physical damage, we know is generational trauma. So it's coming from the parent. It's coming from the grandparent and up the ancestral line. And are they infected with the fungus? If the fungus was present in them, that they would be vulnerable as well to the fungus. I think, again, that's probably more of a question for Grant. Yeah.
So my understanding, it's the generational trauma is on the father's side, right? So it wouldn't mean that the mother is necessarily infected with the OCD for the child to have the OCD. Yeah,
exactly.
Which then kind of leads into the second part of the question, which was, so going forward, could OCD occur less frequently as the fungi is being healed from the population?
I suppose if enough people were treated with the process, then that would probably be it. Yeah, yes.
Yep. Do you include psychosocial factors in affective problems like OCD, e.g. divorce, etc., when a person finds they have anxiety symptoms?
That would be the big picture of counseling someone with anxiety, would be the psychobiosocial picture of what's going on in their lives. But this process is specific to the anxiety that feels like you're vibrating in that anxiety, like that fear fungus anxiety, and the contamination elements of it. So this process would be specific to reducing or eliminating those specific symptoms from the psychobiosocial picture. And then, of course, you'd have remaining anxieties, remaining stuff that has nothing to do with these funguses that you'd have to address separately.
Yeah.
Yeah.
Excellent.
Yep.
Okay. Well, that's probably time. So thank you very much for your time.
Great.
Appreciate it.
Thank you.
Thank you for watching. For more information, please visit www.peakstates.com and subscribe to our YouTube channel.